Hello, good evening. Welcome to the 13th IFSO Journal Club. It is my honor today to be interviewing Dr. Ali Reza Khalaj from Iran. Dr. Reza has contributed to a great paper. Dr. Reza hails from the Tehran Obesity Treatment Center, Department of Surgery, Faculty of Medicine, Shahid University, Tehran, Iran. The title of his paper that we have picked for this journal club is Protein Calorie Malnutrition Requiring Revisional Surgery After One Anastomosis Mini Gastric Bypass, case series from the Tehran Obesity Treatment Study Group. Dr. Ali Reza Khalaj, welcome to the interview.
Thank you very much for inviting me and choosing my paper in the IFSO Journal Club. Thank you very much.
So this paper will be discussed at length at the formal meeting, which is going to be held in July, on the 16th of July, and we look forward to receiving your questions through Facebook and as well as active participation at the Journal Club itself. So Dr. Khalaj, let's move on. First of all, could you basically tell us about the situation of bariatric surgery in Iran? We've not heard a lot about it, but my personal meeting with you enlightened me a lot. You've got a great database and you've got a journal club almost every month. So could you in brief introduce bariatric surgery in Iran for us?
That's true. There's some problem. Sorry, there was a problem in my computer. Yeah.
So could you introduce bariatric surgery in Iran to us?
Yeah, in Iran, we have 80 million people in Iran and near 2.6% morbid obese patients, BMI more than 40, and 8% BMI more than 35 is a very big problem in Iran. And recently we have a lot of problems with obesity, and in Iran we are one chapter of IFSO, and in the 6th University of Iran now we have the fellowship program for bariatric and laparoscopic surgery training center in 6th center in Iran. And my office, my center, Tehran Obesity Treatment Center, is the private center that's connected with the Research Institute of Endocrine Science of Iran. And we start our work in 2013. Until now, we did more than 4,000 cases in center, and it's private, and we have a very good database, and we publish at least 10 paper about our study. And I think in the future we can publish a lot of paper about the type of different type of operation. In the beginning, we did the beginning of my career in the obesity, a lot of runway gastric bypass. And in 2013, we start MGB, OGB gastric bypass, and we did 189 200 centimeter BP limb. And after that, after publication, after seeing some problem, we changed our policy to 160.
Thank you, Dr. Khalaj. So, Dr. Khalaj, what percentage of your procedures are now one anastomosis gastric bypass? What percentage?
In my clinic, 40% of cases. In Iran, I think more than 50%, like the US, 50% asleep. But in the bypass group, Iranian surgeon, I think, do most mini gastric bypass, MGB, OGB gastric bypass in Iran. And our colleague had a lot of experience about this type of operation.
Great. So I think we will leave the discussion to one anastomosis gastric bypass, mini gastric bypass for the later part. But what I'm interested in knowing is you've picked a very interesting topic, which is protein calorie malnutrition as an outcome here. Are you worried with the kind of numbers you're seeing? Because for 189 patients, about 3 years follow-up, your rates are about 3.7%. So does that worry you?
Yes, yes, because in the literature, the rate of complication, rate of protein calorie malnutrition is lower than this. As you know, for example, in the Mahavar publication, this is a lower than, and in my case, I don't know why. And because we did the operation in a multidisciplinary team, and after operation, my nutritionist see the patient, but we use, I think, in my opinion, is that the 200 centimeter is very much for Iranian population. And we had in this paper, we had 3.7% of patients require revisional surgery.
So just probably the last question before we go on to the conclusion is, you have brought a very important point about the role of the biliopancreatic limb. Would you then take it on to discuss that what is the importance of the total limb length and elemental limb length and biliopancreatic limb length here before we move on to your final conclusions?
Yeah, it seems that the total length of the small intestine is very important. But as you know, because why MGB, OAGB was popular, and because it is a simple operation, it is very effective. And if you want to measure the whole length of intestine, I saw some expert surgeon with complication during the measurement of the total limb. And it increased the length of operation. In my opinion, you should find the easier way for operation. If you find operation without measurement of the limb and choosing, for example, 100 centimeters in all patients, and you don't have much more, because MGB or OAGB has the much more better result for resolution of comorbidity and everything. When you choose one OAGB depending on ROAM gastric bypass. Yeah.
Thank you for that lovely insight. I think what we would do is, Dr. Khalaj, on the day itself, we will come back to this hot topic of your debate. I think many people are interested in this, and we will keep the thunder for the day of itself to discuss more about this controversy of biliopancreatic limb. So thank you very much for the interview, and I receive your conclusions very well, and I look forward to having a very fruitful discussion with our audience and with you on the 16th of July 2019. Thank you very much.
Thank you very much. In 16th of July, I think we should discuss in detail about the limb and the alimentary limb, BP limb, and everything about this procedure. Yeah.
We shall do that. Thank you very much. It was great speaking to you.
Thank you very much. Thank you.